This chewable tablet is a pediatric multivitamin containing 50 micrograms of lutein. It is used to treat or prevent vitamin deficiency in children due to poor diet, certain illnesses, or during pregnancy. Vitamins are important for the body and help maintain good health. The recommended daily dosage and the optimal timing to take this medication will be discussed in this video. Make sure to chew the Pediatric Multivitamin No.233-Lutein 50 Mcg Chewable tablet thoroughly before swallowing, usually once a day as directed. It's important to follow the directions on the product package or as directed by your doctor, and not to exceed the recommended dosage. If you have any questions, don't hesitate to ask your doctor or pharmacist. Taking this medication regularly will help you get the most benefit from it. Try to take it at the same time each day to help you remember. Some common side effects of Pediatric Multivitamin No.233-Lutein 50 Mcg Chewable tablet may include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, it's important to consult your doctor or pharmacist. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. While rare, a very serious allergic reaction to this drug is possible. Seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or difficulty breathing. This is not an exhaustive list of possible side effects, so if you experience any other effects, it's important to contact your doctor or pharmacist. As for the best time to take this medication, it is recommended to follow the dosage instructions provided by your doctor or on the product label. It may be taken with or without food, but it's important to take it at the same time each day to maintain consistent levels in your body. If the multivitamin you give your child contains iron, it is crucial to keep it in a place that is inaccessible to children. Accidental consumption of iron-containing products is a major cause of fatal poisoning in children under 6 years old. In case of overdose, seek immediate medical assistance or contact a poison control center. Before giving this pediatric multivitamin to your child, it's important to talk to your doctor or pharmacist about any allergies they may have. This product may contain inactive ingredients that could cause allergic reactions or other problems. It's also important to discuss your child's medical history with your doctor or pharmacist, especially if they have a history of alcohol use or abuse, liver problems, or stomach/intestinal problems. If the multivitamin contains folic acid, make sure to inform your doctor if your child has a vitamin B12 deficiency before giving it to them. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating the anemia, which could lead to serious nerve problems. This medication may contain aspartame, so if your child has phenylketonuria, PKU, or another condition that requires them to restrict their intake of aspartame, consult your doctor or pharmacist before giving them this medication. Before your child undergoes any surgery, make sure to inform the doctor or dentist about all the products they are using, including prescription drugs, non-prescription drugs, and herbal products. If your child is pregnant or breastfeeding, it's important to consult a doctor before giving them this medication. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk of experiencing serious side effects. This is why it's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's also important to consult with your doctor before starting, stopping, or changing the dosage of any medicines. If your multivitamin contains iron, it's best to avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. It's recommended to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin contains folic acid, it's important to inform your doctor or pharmacist if you take certain anti-seizure drugs. Additionally, this medication may interfere with certain lab tests, potentially causing false test results, so it's important to make sure that lab personnel and all your doctors are aware that you use this drug. Always follow your healthcare provider's guidance and recommendations. If you suspect an overdose or serious symptoms such as passing out or trouble breathing, it is important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. Remember to keep all your scheduled medical and lab appointments. It's important to note that this pediatric multivitamin is not a replacement for a healthy diet. It's always best to get your vitamins from nutritious foods. Make sure to maintain a well-balanced diet and follow any dietary recommendations given by your doctor. If you forget to take this multivitamin on your prescribed schedule, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Don't take 2 doses at once to make up for the missed one. It's important to store this pediatric multivitamin at room temperature, away from light and moisture. Avoid keeping it in the bathroom and make sure to keep it out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product when it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. Remember, always keep medications out of reach of children and pets. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.